comfort. Can Bell's palsy be prevented? Maintaining overall health with a balanced diet and regular exercise is key. Practicing stress reduction techniques can also support your immune system. A healthy lifestyle helps keep your body resilient. What medical treatments are available for Bell's palsy? Doctors may prescribe steroids to reduce inflammation and antiviral drugs. Physical therapy exercises are also vital for regaining facial muscle control. Early intervention can significantly improve recovery.
Ever had a headache so bad it felt like your head was in a vice? That might be a migraine, which is way more than just a bad headache. It's a neurological condition that can cause throbbing pain, often on one side of your head. Along with nausea and sensitivity to light and sound, migraines are complex. So what triggers these intense episodes? It can be a mix of things: stress, changes in sleep, and even hormonal shifts. Certain foods like aged cheese or processed meats can also be triggers. Everyone's triggers are different. Tracking yours can be a game changer. To help prevent them, maintain a regular sleep schedule and stay hydrated. Manage stress through things like yoga or meditation. When you do get one, doctors might suggest over-the-counter pain relievers or prescribe specific migraine medications. It's all about finding what works for you. If you're struggling with migraines, please talk to a healthcare professional. Thanks for watching.
Ever had a headache so bad it felt like your head was in a vice? That might be a migraine. It's way more than just a bad headache. A migraine is a severe, throbbing pain, usually on one side of your head. It can also bring on nausea, vomiting, and extreme sensitivity to light and sound. So what's the difference? A regular headache is typically less severe and doesn't have these extra symptoms. Migraines can be triggered by stress, certain foods, or even changes in the weather. Doctors might suggest lifestyle changes or prescribe medication to manage them. Thanks for watching. Subscribe for more health tips.
Welcome to Understanding Multiple Sclerosis, or MS. It's a chronic disease impacting the brain, spinal cord, and optic nerves. MS specifically damages the myelin sheath, affecting nerve communication. What causes MS? It's an autoimmune disease. Genetic predisposition, environmental triggers like vitamin D deficiency, and certain viral infections all play a complex role. Ensure adequate vitamin D, avoid smoking, and eat a balanced diet. Regular exercise and effective stress management also help. Early detection and consulting healthcare professionals are crucial. How is MS treated? While there's no cure, treatments manage symptoms. Disease-modifying therapies slow progression and reduce relapses. Symptom management addresses fatigue and pain. Physical, occupational, and speech therapies improve daily life. Medications, lifestyle adjustments, and support groups are vital. Personalized treatment plans are essential for managing MS. Learn more about MS and support research.
This is the most recognized type. The body stiffens, followed by rhythmic Certain triggers may provoke seizures, including lack of sleep, stress, flashing lights, alcohol, and missed medications. Some people experience an aura before a seizure, unusual smells, fear, tingling sensations, or visual changes. Stay calm. Lay the person on their side. Remove nearby sharp objects. Do not put anything in their mouth. Time the seizure. Call emergency services if the seizure lasts more than 5 minutes, repeats quickly, or if the person is injured or pregnant. Doctors diagnose epilepsy through medical history, physical examination, and brain tests. An EEG, or electroencephalogram, records electrical activity in the brain and helps identify abnormal patterns. MRI scans provide detailed brain images to detect tumors, scars, or structural abnormalities. Epilepsy is often manageable. Treatment focuses on controlling seizures and improving quality of life. If medication fails, doctors may recommend surgery to remove the seizure-causing brain area. In some children, a high-fat, low-carbohydrate ketogenic diet helps reduce seizures. Not all epilepsy can be prevented. However, preventing head injuries, treating infections early, and proper prenatal care reduce risk. With proper treatment, many people with epilepsy live normal, productive lives, studying, working, and raising families. Epilepsy is not contagious. It is not caused by spirits or curses. It is a medical brain condition. Emotional and family support is essential. Education reduces stigma and builds confidence. Epilepsy is manageable with awareness, medical care, and support. If you or someone you know has seizures, seek medical help. Early treatment can change lives.
Genital herpes is a common sexually transmitted infection. It mainly affects the genital area. The cause is the herpes simplex virus. HSV, too, is the most common cause. It spreads through sexual contact. Even without visible sores, it can spread. Symptoms include blisters, sores, itching, or pain. Some people have no symptoms at all. There is no permanent cure, but it is manageable. Doctors use antiviral medicines. Treatment shortens outbreaks and lowers spread risk. Antivirals reduce pain and outbreaks. Use condoms during sexual activity. Get regular STI testing. Avoid sexual contact when sores are present. Talk openly with your partner. See a doctor if symptoms appear. Genital herpes is common and manageable. Awareness, prevention, and treatment protect everyone.
Why do some hands tremble uncontrollably? Why does a simple task like buttoning a shirt become difficult? Behind these signs may be a neurological condition known as Parkinson's disease. Parkinson's disease is a progressive disorder of the nervous system that mainly affects movement. It develops gradually and worsens over time. Our movements are controlled by a delicate balance of brain chemicals. One of the most important is dopamine. Dopamine helps transmit signals that coordinate smooth and controlled muscle movement. In Parkinson's disease, nerve cells in a region called the substantia nigra begin to die, leading to reduced dopamine levels. When dopamine levels fall, the brain cannot properly regulate movement, causing tremors, especially in the hands at rest. The four main motor symptoms are tremor, muscle stiffness, slow movement, and impaired balance. The tremor often starts on one side of the body, typically in the fingers or hand. Muscle stiffness makes movement painful and restricts flexibility. Bradykinesia, or slowness of movement, makes everyday tasks take much longer. Postural instability can cause frequent falls in later stages. Parkinson's also causes non-motor symptoms like depression, sleep problems, constipation, and memory changes. The exact cause of Parkinson's disease is still unknown. Age is the biggest risk factor. Most cases develop after the age of 60. In some cases, genetic mutations can increase the risk. Long-term exposure to certain toxins or pesticides may contribute. Abnormal protein deposits called Lewy bodies are found in affected brain cells. There is no guaranteed prevention, but healthy habits may lower risk. Regular physical activity supports brain health and may delay symptoms. A balanced diet rich in fruits, vegetables, and omega-3 fatty acids supports overall brain function. Limiting exposure to harmful chemicals may reduce risk. Keeping the brain active strengthens neural connections. There is no single test. Doctors diagnose Parkinson's based on medical history, symptoms, and neurological examination. Doctors assess tremor, muscle tone, coordination, and walking patterns. The most effective treatment is medication that increases dopamine levels. Levodopa is the gold standard medication. It converts into dopamine in the brain and improves symptoms. Other drugs, called dopamine agonists, mimic dopamine's effects. In advanced cases, deep brain stimulation surgery may help control tremors. Physical therapy, speech therapy, and occupational therapy improve quality of life. Parkinson's disease may cause hands to tremble, but with early diagnosis, proper treatment, and support, patients can continue to live meaningful and active lives.
Memories define who we are. They connect us to love, family, and life experiences. But what happens when those memories slowly begin to disappear? This is the story of Alzheimer's disease. Alzheimer's disease is a progressive brain disorder. that slowly destroys memory and thinking skills. It is the most common cause of dementia worldwide. Dementia is not a single disease. It is a group of symptoms affecting memory, reasoning, and daily functioning. Alzheimer's disease accounts for most dementia cases. In 1906, German psychiatrist Alois Alzheimer first described this condition after studying a patient with unusual memory loss. In Alzheimer's disease, brain cells shrink and die. Abnormal protein deposits form between and inside brain cells, disrupting communication. One hallmark is amyloid plaques, sticky clumps of beta-amyloid protein that build up between nerve cells. Another hallmark is tau tangles, twisted fibers inside brain cells that block nutrient transport and lead to cell death. Early symptoms include forgetting recent conversations, misplacing items, and difficulty remembering names. As the disease progresses, confusion increases. Patients may struggle with language, decision-making, and recognizing loved ones. In advanced stages, individuals lose the ability to communicate and require full-time care. The exact cause is not fully understood, but it involves a combination of genetic, lifestyle, and environmental factors. Age is the biggest risk factor. Most people diagnosed are over 65. Certain genes increase risk. A family history of Alzheimer's can raise the likelihood of developing the disease. The APOE4 gene variant is known to increase risk, though not everyone with it develops Alzheimer's. Lack of exercise, poor diet, obesity, and high blood pressure may contribute to brain damage over time. Severe or repeated head injuries may also increase risk later in life. There is no guaranteed way to prevent Alzheimer's, but healthy habits may reduce risk. Regular physical exercise improves blood flow to the brain and supports brain health. A balanced diet rich in vegetables, fruits, whole grains, and omega-3 fatty acids supports cognitive function. Keeping the brain active through reading, puzzles, and learning new skills may strengthen neural connections. Staying socially active helps reduce isolation and supports emotional and mental well-being. Managing diabetes, high blood pressure, and cholesterol may lower Alzheimer's risk. Doctors diagnose Alzheimer's through medical history, cognitive tests, brain imaging, and sometimes blood or spinal fluid tests. Scans such as MRI or CT help doctors see brain shrinkage and rule out other causes. While there is no cure, certain medications can temporarily improve symptoms or slow progression. Drugs like donepezil help boost chemical messengers involved in memory and thinking. Newer treatments target amyloid plaques in the brain, offering hope for slowing disease progression. Supportive care includes routine structure, safe environments, therapy, and caregiver support. Alzheimer's affects not just the patient, but the entire family. Emotional support and patience are essential. Alzheimer's disease may steal memories, but it cannot erase love. Awareness, early detection, and compassionate care can make a difference. Protect your brain. Protect your memories.
A long flight, cramped legs, little movement. What if that stillness could form a dangerous blood clot? This is deep vein thrombosis, or DVT, a silent but serious condition. Deep vein thrombosis happens when a blood clot forms in a deep vein, usually in the leg. These veins carry blood back to the heart. When a clot blocks them, it becomes dangerous. If part of the clot breaks off, it can travel to the lungs.